In today's video, we are going to go over two mobility problems that interfere with normal shoulder range of motion, and of course, exercises to address these two very common problems that might be the root cause of why some of you either cannot reach your arm above a certain height or you have pain when attempting to reach your arm above shoulder height. If you're new to this channel, I'm Tara. I'm a neurologic physical therapist, and on this channel we talk about anything and everything related to mobility, health, fitness, and mindset in the context of neurologic injuries, with the end goal of empowering you with as many tools as possible to take ownership of your rehab and your health to live an overall more mobile, more active, pain-free, happier, healthier life. Now, before we dive into today's video, as a reminder, if you are a member of our Bronze membership program, there will be a handout that goes along with this video that is only available to Bronze and Gold members. If you want to learn more about our membership programs or to sign up to get instant access to these handouts, you can visit www.rehab-hq.com. Now let's dive into two pretty common problems that have come up recently with several patients that I have seen in person. So they are top of mind right now, and so I thought I would just make a video on some of the things that we are working on to help restore normal shoulder range of motion. So let's first talk about what are some of the common barriers that interfere with normal shoulder range of motion. One is a scapula that doesn't move. So we've talked about that, or I've talked about that a lot on this channel. I will link some of the videos where I've talked about this in more depth in the description below. But long story short, or very simplified explanation, when we reach our arm overhead, the shoulder blade on the back of the shoulder kind of needs to rotate upwards a little bit and move backwards. Now, it doesn't technically move backwards. However, the reason I bring that up is that some people can't reach overhead after a stroke because that shoulder blade is so far forward. So for those of you, the reason you can't reach overhead is because the shoulder blade is too far forward and we need it to move backwards in order to achieve full overhead reaching. And then just to repeat, I also said there is a little bit of upward rotation. Those two things, those two motions of the shoulder blade on the back of the shoulder have to happen in order to really get the arm bone, that ball and socket joint, to glide the way that it should, for that ball to glide inside that cup to get that arm to rotate upward, or this arm bone to rotate upward. The other common issue after a stroke is that ball and socket joint, that ball sits a little bit forward in the joint. And of course, when it's not lined up directly in the joint, that can also cause problems. So another area that we work on here, or I work on with people here in therapy, is working on posterior mobs. So moving that head backwards. Now, a lot of times that does require a therapist. The exercises that we go over today shouldn't replace therapy, but they are ways to just kind of supplement therapy in between therapy sessions. Or for those of you that don't have therapy, although they're not ideal, you will get a little bit, if your head, the shoulder, the arm bone sits forward, you will get it to sit back just a little bit. So the exercises that we're going to go over today are working on overhead reaching while using some tools to get the shoulder blade to kind of somewhat upward rotate. Now, upward rotation is different from elevation. So a lot of you have elevation. What we want is more upward rotation. So instead of the entire shoulder blade coming up, the inside of the shoulder blade kind of needs to stay down, and just the outside of the shoulder blade needs to rotate up. Okay, so we're going to have I'm going to show you tools that you can do to help to facilitate kind of that upward rotation, as well as if you are someone where your shoulder blade sits really far forward, when we reach overhead, we really need that shoulder blade back a little bit. So we're going to go over tools for that. And then just as another reminder, or just to reiterate, we want to work on posterior mobs of that ball and socket. So the ball moving that backwards. And those are the three things that we're going to go over today. So enough of that explanation. Let's go ahead and dive into the exercises. All right, so for this exercise, what we're doing, remember what I said, is if your shoulder blade sits too far forward, it makes it really hard to lift that arm up above a certain height. So for this one, what we're doing is we are using a TheraBand to kind of pull that shoulder blade back as we reach overhead. All right, so for this exercise we're doing, remember what I said, that a lot of you kind of elevate your shoulder blade when you try and reach overhead. What is ideal is if the shoulder blade can upward rotate. So to get that rotation, what we kind of want to do is keep the inside of the shoulder blade down a little bit, right? So if you can visualize that, that gives us more of a rotation versus the entire shoulder blade coming up. So again, for that, we're going to use a TheraBand, and a lot of you will be able to do this. Just use your stronger arm. You know, kind of you can do that one-handed. I think a lot of you will be able to figure that out. And you want to get it as close to your neck as possible. So you don't want it way out on the tip, because remember, to get that rotation, we want it kind of more to the inside. So get it really close to your neck as much as possible, and then you're gonna lift. So this does two things. It will stop some of you that if your whole shoulder blade is elevating, it's just a cue that will kind of keep it down. And then also what we're trying to do is get a little bit of that upward rotation. So keeping the inside of that shoulder blade down and allowing it to kind of rotate up and around the band, which is pulling the inside down. So get that band in place and reach. All right, now for this exercise, we're working on that posterior mob. So if this is the shoulder that we're working on, and again, this isn't ideal. Best case scenario is that you can work with a therapist, but this is an exercise you could do in between therapy sessions to kind of do like a self-mobilization. You're just gonna lean onto the arm. Now, one thing you wanna pay attention to is that your shoulder is not up towards your ear, and you want this arm bone as vertical as possible. And it's really your weight and the arm bone itself, kind of the force coming up through the arm bone, that's kind of mobilizing that shoulder blade or mobilizing that arm bone a little bit. Remember, a lot of you guys, like I mentioned earlier, your arm bone kind of sits a little bit forward in the socket. And what we're trying to do is just kind of push it back a little bit. So they call those mobilizations, but this is one that you can do on your own. Now, another thing you want to pay attention to is if you can, you want to keep your arm rotated out. If it needs to rotate in for comfort, that's fine, but you want your goal to be that you can keep your hand out and not kind of across your body like this. So arm bone out, and then you're just going to shift your weight onto it. Try not to let that shoulder blade come up towards your ear. Kind of try and push it down and away from your ear, and then just lean onto that arm. Again, what we're trying to do is drive the arm bone backwards. Okay, so you're just going to lean on it. Try and have that arm bone as vertical as possible. Hold it for about 30 seconds and then come off. And then that is it for this video. I hope you guys found this video helpful. If you're new to this channel and you haven't yet subscribed, go ahead and hit that subscribe button and turn on that notification bell so that you'll get notified every time I upload new videos. If you're someone who really wants to take ownership of your rehab and really optimize your full rehab potential, you definitely want to check out our Gold membership program. With your Gold membership, you'll get access to over 400 neuro-specific exercises, as well as monthly lives where you can submit questions in advance and I answer those once a month, and access to our private Discord channel where you can interact with me and other members throughout the week and the month. To learn more about that, visit www.rehab-hq.com. I enjoyed spending time with you all today, and I'll see you in the next video. Have a good day.